All right, we're going to look at doing a little bit of trigger point work on subscapularis, one of my favourite muscles, not necessarily for your clients. So I'm going to show you just a technique which I tend to have developed over the last sort of 10 years, which try and softens the blow of working on this muscle. We all know that subscapularis is a medial rotator, and it works obviously in conjunction with our teres minor and teres major. So they're our two synergistic muscles. So when we're treating subscap, we need to be treating those two muscles as well. And primarily, if we extend that a little bit further, our pec major and also our lat dorsi. Although those two muscles we need to be aware attached to the trunk, whereas teres minor and major obviously attached to the scap. So really important that you're treating all of those muscles as opposed to just treating subscapularis as a singular trigger point area. So how do we get to subscapularis? Well, it's a tricky one. Starting off, the first thing that I want to do, bring your clients up into a horizontal position here, and you want to just check what their internal and external rotation is like. So if they are restricted in that medial rotation, or you've got issues with infraspinatus and subscapularis, there's a fair chance that that'll actually show up. And it's not always through the range, it's probably towards the end of that range. So you want to sort of test what the end of that range is like. Now, in order to get access to subscapularis, there's three trigger points. There's obviously two superficial and one deep. So we're obviously not going for that deep one because that's usually pretty unattainable. As far as the trigger points that are more superficial, you'll have one more inferior and one more superior. So one will lie up towards the axillary, and the other one will be down a little bit lower towards the inferior angle of the scap. So what we can do first is bring your clients up into a bit of adduction. Now, just to temper and dampen this, I put a towel, small towel over the top. I'm going to find my region here. If I pick this up, we've got teres minor and major here, and then obviously we come down lower, and then we've got lat dorsi there. Okay, so we want to be anterior to that, to fall into the area where subscapularis is. The next thing is to get your clients to relax. Worst thing is that your client's obviously contracting, which is obviously hard because you're going to be sticking your fingers into an area that is actually really quite sensitive. So once we find that area, I'm just going to sort of cup over that anterior border, okay, just through there, and just test the resistance, okay? So you only want to sink in as far as they'll allow you. Don't try and push in. That's the worst thing you can do because they'll just push you out and fight you the whole time. So just sink in. Once you've sunk in, have a bit of a feel upper, lower, whichever trigger point you want to find first. So if we'll go for the more superior one, you'll find that there's the axillary area there that we want to stay away from. So we just sink down there, and then as we sink down, we're going to bring their arm down towards them, okay? So at this point here now, you're just going to sink in as the arm goes down because that'll soften off and relax. The other hand's going to come over the top, and you're going to basically push the shoulder down, but you're going to sink in at the same time as well. So once you're in there, once you find that resistance, don't try and push in any further, just sink to that. And then what I tend to do is just rock backwards and forwards, okay? I'm not pushing in anymore, I'm just rocking backwards and forwards with the shoulder. So inferior, superior, back and forwards, and then sinking in, just allowing the tissue to relax as much as I can. Now you can also bring the shoulder back towards you and also anteriorly as well. So the more you go anteriorly, the more give you'll get, so you can sink in a bit more and just repeat that process, okay? Backwards and forwards, anterior, posterior, just working the tissue like that, okay? And you'll find that it'll soften off. And as you bring it back posteriorly, that's the area that you want to finish in, okay? So just to recap, going down, up, and as you do, you sink in a little bit more, posterior, anterior, back, up, down. Now, if you want to change your positions of your trigger point, so if I wanted to come down a little bit lower, then I come out, abduct again, engage, come down again, and then start the process again. Up, down, posterior, anterior, and just work that tissue through there like so. Now, obviously it's an area that we don't want to spend a huge amount of time in, so give yourself a good 30 seconds to work this. Make sure that your clients are breathing, because the worst thing is that they shut down their breath. Subscapularis is one of those muscles that does go under the radar because it's hidden away. In terms of frozen shoulder, I actually don't even treat subscapularis. I treat the infraspinatus, which inhibits the subscapularis. But if I'm treating someone with an impingement syndrome or a rotator cuff issue, then most likely I'll engage with the subscapularis, as well as teres minor, major, lat dorsi, and pec major as well, because they all work synergistically. So it's really important that you're nailing those ones. Once you're finished, then you can get back up and then just reassess what that range of movement's like. And it's probably just that last 5 degrees that you want to be assessing. All right, so that's subscapularis.